Did you know that Americans spend more on prescription drugs than any other country in the world? In fact, prescription drug prices in the United States have increased by over 200% in the last 2 decades. According to the Centers for Disease Control and Prevention 2024, nearly 1 in 5 Americans report not filing their prescriptions due to high costs, and the US spends over $500 billion annually on prescription medications alone. These statistics paint a troubling picture of a healthcare system where the cost of life-saving medications is spiraling out of control. The rising cost of prescription drugs is not a problem that only affects a small portion of the population. It impacts millions of Americans across the nation. For many, it's a matter of choosing between paying for necessary medications and affording other basic needs like food, rent, and utilities. The increasing cost of prescription drugs in the United States is a critical problem that requires systemic reform to address its root causes, such as monopolistic pricing practices, inadequate regulations, and the lack of transparency, and to implement long-term solutions that ensures affordable medication for all Americans. First, I will outline the extent of the problem and its consequences. Then I will examine the causes behind the rising prices of prescription drugs. Finally, I will propose viable solutions that can address this growing issue. Let us begin by understanding the scope of the problem. In the United States, prescription drug costs have risen at an alarming rate. According to the Health Affairs article, Drug Prices and Shortages Jeopardize Patient Access to Quality Care, AHA, 2024, Americans spend more on pharmaceuticals than any other country in the world. This is not a new issue. It's been escalating for decades. A study published in PubMed 2016 confirms that the growth in drug prices is outpacing inflation and wages, leaving many individuals to choose between paying for their medications or other essential needs. National Institutes of Health 2016. The economic burden of prescription drug is not just felt by those with low incomes, but by the entire population. A report by Kaiser Family Foundation 2023 found a nearly 1 in 4 Americans report skipping or delaying filing a prescription due to high costs. A study published by the Centers for Disease Control and Prevention, CDC 2024, shows that prescription drug spending accounts for about 10% of total healthcare costs in the US, a figure that continues to rise. This trend is exacerbated by an aging population, with many individuals relying on long-term medication for conditions like diabetes, hypertension, and cancer. The rising costs are affecting access to essential medications. The RAND Corporation 2024 reports that many individuals in rural and low-income areas are unable to afford prescriptions, leading to preventable hospitalization and deaths. So what's behind the skyrocketing cost of prescription drugs? One of the leading causes of high drug prices is the monopolistic nature of the pharmaceutical industry. According to the U.S. Department of Health and Human Services 2023, the lack of competition among drug manufacturers allow companies to set prices without transparency or regulation. This practice results in exorbitant costs for life-saving medication. Pharmaceutical companies often use patient laws to extend their monopoly on certain drugs, delaying the entry of cheaper generics. According to a report by the U.S. Department of Health and Human Services 2023, this tactic drives up the price of drugs that should otherwise be affordable once their patent expires. Unlike other countries, the U.S. doesn't have a system of price control on prescription drugs. A 2024 poll by Kaiser Family Foundation reveals that over 80% of Americans support the idea of the government negotiating drug prices, KFF 2024. Pharmaceutical companies spend billions of marketing, which often leads to price inflation. A 2024 article from the Health Affairs blog discusses how marketing strategies not only increase the demand for drugs but also elevate their prices by creating artificial sense of urgency around treatments. AHA 2024. While the problem is complex, there are several steps we can take to address the rising cost of prescription drugs. One solution is to implement price controls or allow Medicare to negotiate drug prices as proposed in the 2022 Inflation Reduction Act, according to a study by the RAND Corporation 2024. Allowing the government to negotiate prices could significantly lower costs for consumers and reduce the financial burden of the healthcare system. Encouraging the use of generic medication is another viable solution. The U.S. Department of Health and Human Services 2023 reports that generics cost from 80 to 85% less than their brand name counterparts, and increasing their availability can help reduce costs across the board. Strengthening policies to prevent pay for delay scams would also foster competition and lower prices. Increasing transparency in pricing is critical. The pharmaceutical industry often lacks clear pricing information, which leaves consumers in the dark about the cost of medication. According to Health.com 2024, implementing mandatory drug price transparency and making this information readily available can empower consumers to make informed choices and avoid overpaying for medications. To ensure that all Americans can access necessary medications, expanding prescription drug assistance programs is crucial. The Kaiser Family Foundation 2023 advocates for expanding these programs to include more individuals, particularly those with chronic conditions who rely on long-term medications. In conclusion, we have examined the scope of the problem, its root causes, and the solution that can address this urgent issue. The rising cost of prescription drugs is a crisis that affects millions of Americans. It is a multifaceted issue driven by monopolistic pricing practices, patient loss, and a lack of regulation. The consequences of this rising cost are profound, with many individuals unable to afford essential medications, resulting in worsened health outcomes and financial strain. To address the rising cost of prescription drugs, we need systemic reforms that include government intervention, increased competition, price transparency, and better access to affordable medications. It is time for us to take actions. By implementing these solutions, we can ensure that the price of prescription drugs no longer stands in the way of Americans' health and well-being. The fight against high drug prices is not just about saving money, it's about saving lives.